I'm John, and for this video, I'm going to discuss the bones, ligaments, joints, and muscle in hip and pelvis, knee, ankle, and foot region. Also, we are going to tackle here the roles and responsibilities of physical therapists and occupational therapists in each region, and how this subject will help us in near future when we become PTRPs and OTRPs. Before we begin, it is important to know first the function of this region. The bony pelvis' main function is to transmit the weight of the body from the vertebral column to the femurs, and it also provides attachment for trunk and lower limb muscles. The bony pelvis is composed of 4 bones: the 2 hip bones, the left hip bone and the right hip bone, sacrum, and the coccyx. The 2 hip bones articulate to each other anteriorly by the pubis ligaments at the symphysis pubis, and posteriorly with the sacrum at the sacroiliac joint. Each hip bone is comprised of 3 parts that fuse together, and these parts are the ilium, which is the largest and most superior of the 3 bones, the ischium, which is located inferiorly, and the pubic bone, which forms the most inferior portion of the hip bone. These 3 structures meet together at the acetabulum. Acetabulum is a deep depression on the outer surface of the hip bone, and it serves as an articulation with the head of the femur, and also this acetabulum forms the socket components of the hip joint. So let's go back to the 3 main parts of the hip bone. So let's start at the bony landmarks located at the medial surface of the ilium. So first we have arcuate line, is a smooth rounded border on the internal surface of the ilium, and also forms the part of the border of the pelvic inlet. Second is the iliac tuberosity, a rough and elevated area found posterior to the iliac fossa and serve as attachment point for sacroiliac ligaments. Next is auricular surface. Auricular surface is an ear-shaped surface and articulates with the sacrum and covered by fibrocartilage. And lastly, we have the iliac fossa. Iliac fossa is a large, smooth concave surface found on the middle aspect of the hip bone. Now let's move on to the pubic bone. This pubic bone is divided into 3 main parts: the body, superior ramus, and the inferior ramus. So now let's move on to the other bone of the hip joint, which is the femur or the thigh bone. Femur is the longest, largest, and heaviest bone in the body, and it measures about 45 cm to 18 inches long. So now let's talk about the greater and lesser trochanter. Greater trochanter is a large prominence that serves as an attachment of gluteus medius, gluteus minimus, and piriformis muscle. Next is the lesser trochanter. It's a small prominence and serves attachment of the iliopsoas muscle. So now let's move on to the other ligaments in the hip joint. So first we have the iliofemoral ligament or the Y ligament. Second is the pubofemoral ligament, and lastly the ischiofemoral ligament. These 3 ligaments connects the head of the femur to the pelvic bone. Knee is a complex joint with 3 bones, which are the distal part of the femur, proximal part of tibia, and the patella. And it is the largest and most complex joint in the body. Knee joint, also known as the tibiofemoral joint, and it is a synovial diarthrodial modified hinge joint. And the motions permitted are flexion, extension, medial and lateral rotation. And the ligaments located here are the lateral collateral ligament, medial collateral ligament, anterior cruciate ligament, and the posterior cruciate ligament. So now let's move on to the second joint, which is the patellofemoral joint, and it is a synovial joint, and the motions permitted here is it slides as the knee joint moves. And the ligaments located here is ligamentum patellae, or the patella tendon or patellar ligament, and we have 2 meniscus, the medial and the lateral meniscus. Lastly, we are now moving to the knee muscle. In the anterior compartment, we have the sartorius muscle and the quadriceps femoris muscle, which are the rectus femoris, vastus lateralis, vastus intermedius, and the vastus medialis. And for the posterior compartment, we have the biceps femoris, semitendinosus, semimembranosus, pes anserine muscles, which are the sartorius, gracilis, and semitendinosus muscles, and the gastrocnemius, plantaris, and popliteus. Ankle and foot is a complex system, and it has 26 bones, 36 joints, and it has more than 100 muscles, tendons, and ligaments. Ankle joint is formed by 3 bones: the distal part of tibia, fibula, and the talus of the foot. So now let's talk about the bony landmarks located at the distal tibia. So these are the medial malleolus, groove 4 tibialis posterior, groove 4 flexor hallucis longus, and the fibular notch. Next are the bony landmarks located at the fibula. These are the triangular subcutaneous area, lateral malleolus, articular surface of lateral malleolus, malleolar fossa, surface for interosseous ligament, and the groove for peroneus brevis. Now let's move on to the bones of the foot. In rear foot, we have talus and calcaneus. In midfoot, we have navicular, cuboid, and 3 cuneiform. In forefoot, we have the metatarsals and the phalanges. So we're done talking about the bones of the ankle and foot region. So now let's move on to the joints and ligaments located at the ankle and foot region. So first we have the tibiofibular joint, located at the distal part of tibia and fibula, and it is held by interosseous ligaments. Next is the talocrural joint, also known as ankle joint, and it has a 1 degree of freedom, which is plantar and dorsiflexion of the foot. In medial aspect of the foot, there is a 4 ligaments also called the deltoid ligaments. These are the anterior tibular ligament, posterior tibular ligament, tibiocalcaneal ligament, and the tibionavicular ligament. While in the lateral surface, we have the 3 lateral collateral ligaments. These are the anterior talofibular ligament, calcaneofibular ligament, and the posterior talofibular ligament. So now let's continue with the joints located at the foot. Now we have the subtalar joint, transverse tarsal joint, talonavicular joint, calcaneocuboid joint, cuneonavicular joint, tarsometatarsal joint, intermetatarsal joint, MTP joint or the metatarsophalangeal joint, and the IP joint or the interphalangeal joint. So now let's move on to the muscles of the anterior compartment of the leg. Here we have the tibialis anterior, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. Next is the muscle located at the posterior compartment of the leg. In superficial, we have the gastrocnemius, soleus, and plantaris. While in deep group, we have the tibialis posterior, flexor digitorum longus, and flexor hallucis longus. Next are the muscles located at the lateral compartment of the leg. These are the peroneus longus and the peroneus brevis muscles. Next, the muscles of the foot at the plantar surface. In first layer, we have the abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. In second layer, we have quadratus plantae and 4 lumbricals, tendons of flexor digitorum longus, and tendon of flexor hallucis longus. In third layer, we have the flexor hallucis brevis, flexor digiti minimi brevis, and adductor hallucis. In fourth layer, we have dorsal interossi and plantar interossi. Lastly, the muscle of the dorsum of the foot, which is the extensor digitorum brevis.
Hi, my name is Mike Conrad Lingad. Now let's talk about the roles of physical therapies in our lower extremity. The lower extremity is made up of bones, joints, and soft tissue, including muscle, and it is responsible for not only supporting our complete body weight, but also maintaining balance and perfect alignment with each stride. For proper movement, the hips, knees, ankles, and feet rely on one another. The body compensates when one is weak or not functioning properly. Instability and misalignment are the outcome. If the primary problem is not handled promptly, this could lead to other problems. Physical therapists are evidence-based healthcare professionals who diagnose and treat people of all ages. who have medical disorders or other health-related issues that restrict their ability to move and perform daily tasks. If you have hip discomfort, physical therapy may be beneficial in controlling your symptoms and improving your total functional mobility. The goals of your physical therapy should be to reduce or eliminate your discomfort, improve your hip range of motion and strength, and restore normal functional mobility. A physical therapist is educated in identifying biomechanical problems in the body. This enables the therapist to create a plan to help you move and use your muscles more effectively. A physical therapist can also detect areas of weakness and poor mobility around the knee joint and create an exercise program to restore muscle balance between the quadriceps and hamstring muscles. Physical therapists may work with you on skills such as balance, gait, the way you walk, and the ability to bear weight, the weight of your body and your foot. While dealing with your foot problems, if you have foot discomfort, all of these functions can be affected. You may not even notice you are walking in a different way to compensate for an issue or that your balance has decreased. The physical therapist will next construct a comprehensive and personalized treatment regimen that will target the malfunctioning region of complaint once the cause of the pain has been determined during the physical therapy evaluation. Specific exercises, manual hands-on therapy, education, work or sport-specific training, and modalities such as electrical stimulation, heat and cold therapy are frequently used in this program.
How does this subject will help you in the near future when you become OTRPs and PTRPs? Hi, my name is Abigail Mazon and taking up BS Occupational Therapy second year student. Anatomy knowledge is essential for all areas of practice, particularly upper limb rehabilitation, both orthopedic and neurological. Occupational therapy need anatomy knowledge to evaluate function and determine treatment. Determination of functional adaptations requires sound anatomy knowledge. Through its unique treatment of surface anatomy, the gross anatomy course aids us in understanding the practical applications of anatomical ideas. Gross anatomy can be thought of as a foundation of medical practice since without a true understanding of the internal organs, it is impossible accurately evaluate, diagnose, and treat disorders, illnesses. This is one of the most important subjects that need to be studied to improve health of the world's population and to be a better future occupational therapy so we can help clients to see the possibilities, not disabilities. Occupational therapy's role is to help people of all ages overcome the effects of disability caused by illness, aging, or accidents so that they can carry out everyday tasks or occupations. Occupational therapy will consider all the patient's needs, physical, psychological, social, and environmental. This support can make a real difference, giving people a renewed sense of purpose, opening up new horizons, and changing the way they feel about the future. Occupational therapy skills lend themselves to new emerging roles such as working with asylum seekers or refuge, working alongside police or fire services, or liaising with psychiatric services. The areas of occupational therapies do is children and young people help babies, infants, children, and young people grow, learn, and have some socialize and play so they can develop, thrive, and reach their full potential. People with physical disabilities, those who may have undergone an amputation to pursue daily activities and favorite hobbies, and learning disabilities. Help them continue with life skills, work, and leisure activities as independently as possible. And people who have mental health issues, help people to develop a personally satisfying routine of everyday activities that creates a sense of purpose and enhance a person's recovery journey.